diet.
6:38 here, Big 550 KTRS. The American Cancer Society is changing its recommendations regarding mammograms. We're going to the expert to find out more. Dr. Teresa Schwartz from SSM St. Louis University Hospital. Thanks for joining us.
Yeah, thank you.
All right, so what does all this mean? Explain this to us.
Yeah, the guidelines for screening mammograms have been a pretty hot topic for the past 6 years because up until then, everybody over the age of 40 screening mammogram for as long as you're healthy. And then in 2009, the United States Preventative Services Task Force changed their plans, but nobody else did. So this is the first time in well over 10 years that anybody else, including the American Cancer Society, has changed what they recommend for mammograms. So the way that their guideline recommendations read now is if you're over the age of 45, nothing changes. Screening mammogram once a year for as long as you're healthy. The changes are for women in that 40 to 44-year-old age group of average risk. So women that don't have a strong family history or haven't had multiple biopsies before, if they have an average risk of getting breast cancer, the study that they put together shows that the risk of a screening mammogram was higher than the risk of getting cancer.
Explain that.
Yeah, so there's the risks of screening mammograms usually come down to a false positive and a whole bunch of anxiety, extra tests, extra biopsies, unnecessary follow-up. And that's what they worry about, is putting that kind of undue risk on that young age group without the high yield of having a large breast cancer diagnosis.
So there's a large number of people who are diagnosed as having breast cancer that don't have breast cancer.
Well, it says, hey, your mammogram looks a little abnormal because we don't have 20 years of follow-up to compare to. Why don't we bring you back in 6 months for a follow-up picture? Why don't we get a biopsy and then it comes back benign?
Gotcha.
So the risk of that is higher in the younger women than it is for older women.
All right. So what does the 30-year-old say? Because you hear stories that 30, 35-year-old women are getting breast cancer.
They do. It's a very low number, but they do. Those are women that usually have a pretty suspicious family history or have something palpable. Right now, there are no recommendations for anybody under the age of 40 to ever get screened with a mammogram. It's just not that good in that age group. But if they have something abnormal on exam, the rules change. It's really just the women over 40 that normally would have been getting screened without having any problems, just coming in once a year. But those women, unless they have a higher risk of getting breast cancer, the American Cancer Society is saying they shouldn't get screened every year.
Dr. Teresa Schwartz is with us, SSM St. Louis University Hospital surgeon. Go ahead, Kelly.
And again, the women after 45, it's still the same thing.
Correct. No change. After the age of 45 and for as long as you're healthy.
I think I've talked to you about this before, about African-American women, because African-American women seem to, when they get breast cancer, it seems to be more aggressive.
It is. They have a lower incidence of getting breast cancer than white women, but when they do, it tends to be more aggressive and they tend to die more often. But those cancers, they didn't differentiate out if there's a separate recommendation for race, but it's also because the black women numbers are so much lower than white women. So they would have to follow the same guidelines that everybody else does.
October is Breast Cancer Awareness Month. We keep hearing that women need to get tested, women need to go in. How many women don't go in and get tested or don't do what they're supposed to do?
You know, that's a great question, because if they're not coming in, I wouldn't see them. I do see a lot of women who had potentially ignored a problem for a little while or didn't want to be seen out of fear, because this is a pretty scary diagnosis. And in fact, just going in for a mammogram is pretty anxiety provoking. Mm-hmm. People are scared the second the test gets started and then sitting on pins and needles until the results come back. So I'm sure there are a number of women that are afraid to go in to get tested because they don't want to hear the results.
Right.
So based on this, I'd say anyone over the age of 45, we're going to have to figure out a way to get beyond those fears so that they know that early diagnosis is really the best way to make sure they have a great outcome.
Well, they have come leaps and bounds, right? I mean, the treatments have been extraordinary and have developed through technology over the years,
No,
right?
they have, and everything has become more tolerable. And some women that saw their mothers or their grandmothers go through what would seem like now horrendous types of treatments, it has really gotten, it's a whole new world, to be honest. So what they saw before is not what we would do now.
What about mammograms? You always hear that's not the best way to test. Are there other tests in development to get a better reading?
Not for screening. So mammograms, no question about it, they're the best screening modality that we have.
What about the self-tests, or they say once a month check type of deal?
There is no data to say that a self-exam finds cancer any earlier. And now even the American Cancer Society guidelines say that a clinical exam wouldn't be helpful. So that's the first time anyone said a doctor's exam doesn't show an increased yield or increased finding of breast cancer that doesn't change survival. So just mammogram.
So the story of finding a lump is what I mean. It's just a happenstance. It's just anecdotal.
Yeah, I would say most of the time, whenever people find something, it's almost by accident. Putting on lotion, changing clothes, just happen to see a difference in the way they look in the mirror, and that's all. It's hardly ever because they were having some due diligence and doing an exam every month.
The best way is to get that mammogram.
It is. That's what picks up things at its earliest stage, the stuff you can't feel. That's where we would like to find it, especially in the 45 and above age group.
So basically, get to the doctor and get tested.
Yeah, at least for this 40 to 44 age group, I think there's a lot of women that are going to have trouble knowing what to do. Because with this guideline change, their primary care may not know what to tell them to do in terms of screening. So if you're able to go in and talk about what your risk of getting breast cancer is, and if mammograms in that age group would benefit you, I think that's their best tool. Anyone over the age of 45 should just continue getting a mammogram once a year.
Dr. Teresa Schwartz, SSM St. Louis University Hospital. We always love you here. Thanks for checking in.
No, thank you.
You got it. 843, Big 550, KTRS. Ladies and gentlemen, it's time to send flowers.